Okay, right, Lesley, this is your own YouTube video. Okay, so basically, this is a release that you're going to do for your pain that's going from here into here and emanating down into the knee, which will continue to eat through the body if we don't address it. So I'm going to give you 4 exercises. So video purposes, I'm filming there and talking to you there. Okay, so I suggest doing this in the lounge, and you need a tennis ball. That's not a tennis ball, but that's what we're going to do. So the first thing that we did was basically we got our tennis ball, and then we lay down on the floor, and then we just lifted the left glute and then rolled onto it. You will find that point straight away, but it won't be its maximum. Then what I want you to do is just let that leg open and close, keeping the right leg still. This is the left leg, and taking it down. Do 5 to 10 of those. Lift and then replace just a little bit deeper and repeat the process. That's 5 to 10 of those. 2 spots. You're then going to remove the ball, slide it out in exactly the same line and place it there. And then you're just going to let the knee drop, and then I'm going to let that left leg drop onto it. You might need to hold it. Push off the right leg, and then I'm just going to release into that side pocket there. So I'm pushing off that leg and letting that knee relax. So that's all part of the same movement, okay? Hold that for as long as you want to, a minimum of 20 seconds, and then come off of it. That was number 1 movement. Number 2 movement, I'll change the order because this will be a little bit better. You're going to roll it over, place it on that little soft pocket that it's difficult to find, but once you know where it is, it's not too bad. Hold it in position and then lie on it. And then you might need to just keep poking it round. Don't let it go onto the spine. So you might need to move it up or down, and then you'll find your sweet spot. Lie for a few seconds, and then we'll have that little left leg maneuver out to the side. Again, 5 to 10 times. Don't do it overly quick. Then remove it, sit yourself up. This is that one that I call a commando. So if you were, I don't know, we've all seen films where they're going under barbed wire and they sort of like do that, yeah? Okay. What you're going to do is you're going to have one leg straight and one leg in that commando position. And you're going to get that, think about your hip bone and then the soft pocket 2 inches down and 1 inch over. That's your start position, okay? So ball can go down there. Again, remember we're doing this in the lounge so we don't have to worry about area. Gently lower yourself onto it. I'm going to remove that because I can't roll on that. Body weight on the left side, and then you're going to slide that right leg up like that, and then you're going to gently pull yourself forwards, move your elbows, and then move that leg. So you're going to use the leg to keep your hips square. You're going to use the leg to push yourself forward and your elbows. And you're going to roll down all the way from there, tracking all the way down to the knee. And you'll find your own pain. It might be to the outside, it might go onto the inside, it might go right the way. That do not go over the joint. And you might find that you'll get little different pockets. It might move around as you're doing it, okay? Right, and then the final one, I do suggest that you go a little higher on this one, Lesley, okay? Again, so we've got that, we've got 2 lying on our back one, and we've got 2 lying on our front one. So I've just got a normal tea towel, to which I'm just folding it as small as I can, and it's into that little sandwich there. So a little sandwich. So that's going to go on there. I'm going to put my tennis ball on that. So you've got like a little platform for it. And then all you're going to do is hip bone up to into. Okay, so that one is hip down to into. This one is hip up to in. Yeah,
Right.
So down, in, up, in for the second one. And then all you're going to do is gently lower yourself down onto that position. Relax into it. You'll go down to start with, and then push yourself up on your elbows, and then you're working on getting that release. And it might make you feel a little bit sick, this one, okay?
Okay.
But it's and it'll soon give, and that'll help with with that lower back pain that we're getting. Now that release that we've just done is for it releases the back muscle. You know, you're getting back pain there.
Yeah.
That one where you're lying down is the release for that muscle.
Right, okay.
Because that muscle threads through the pelvis and attaches here. So when you walk, you sort of, so the muscle that you just released when it's on the tummy starts there, threads through the pelvis and comes out the other side. So that when you walk like that, you're pinching it, which is what's causing the pain down there. So we've just released it all. So that's your routine. I'll switch this off now.
Okay.